Sleep apnea is when snoring becomes a metabolic warning. Snoring is not simply disturbing your partner's sleep. It repeatedly starves your body of oxygen and disrupts your metabolism. One of my first patients with obstructive sleep apnea was a woman with obesity who arrived in London after splitting with her boyfriend because of snoring. She presented with a severe headache. Her blood tests and scans were negative. Her sleep study confirmed the diagnosis. She declined CPAP, the standard treatment, but as she lost weight, her condition improved. That patient taught me something important. Sleep apnea isn't just about sleep or snoring. It's closely connected to metabolic health. In obstructive sleep apnea, the upper airway repeatedly narrows or collapses during sleep. Breathing stops or markedly reduces, oxygen falls, and the brain sounds the alarm. The body releases stress hormones, including adrenaline, to help restore breathing. Those repeated surges of stress hormones increases blood pressure and glucose and contribute to insulin resistance. Fat stored around the neck, a surrogate marker for central obesity, can increase the likelihood of upper airway narrowing or collapse during sleep. However, snoring does not always mean sleep apnea. Simple snoring can be benign. Snoring becomes a concern when it's loud and persistent, accompanied by pauses, choking, or gasping during sleep, morning headaches, unrefreshing sleep, or excessive daytime sleepiness. Charles Dickens described something similar in the Pickwick Papers. Joe, the sleepy, snoring fat boy. The character has inspired the medical term Pickwickian syndrome. Today, breathing disorders is common, affecting 1 in 6 adults in the UK. The diagnosis and severity are assessed by a sleep study. This is called apnea index. Accordingly, obstructive sleep apnea is classified as mild when the person has 5 to 14 events per hour, moderate 15 to 29 events when the breathing becomes interrupted 30 times or more per hour. This means once every 2 minutes. Treatment depends on the individual and the severity. It can include weight reduction, like my patient who went on a healthy diet, intermittent fasting, and regular exercise. It is sensible to reduce alcohol, stop smoking, and avoid sedative medications. These can cause collapse of the upper airway during sleep. Sleep on your side to stop the tongue collapsing backwards to block the airway. Some patients benefit from the use of simple mandibular devices. Others require CPAP to keep the upper airway open using positive pressure. So, the message I want you to remember: when your airway repeatedly closes at night, that does not only disturb your partner's sleep, it can affect your blood pressure, glucose regulation, cardiovascular system, and metabolic health. Your body cannot repeatedly fight for oxygen throughout the night and expect to perform at best the following day. So, if your partner or a family member tells you that you snore loudly, stop breathing, choke, or gasp during sleep, and you wake up with headache or struggle to stay awake during the day, don't just laugh it off. Get it investigated. Sleep apnea deserves proper medical assessment without delay. Thank you.